Joining our neighborly chat today is Professor Rosalie Corona. She is a professor of psychology at Virginia Commonwealth University. She is the founding director of the VCU Latinx Mental Health Clinic. Dr. Corona's community engagement research focuses on health promotion and risk reduction for the Latinx American and African American youth and their families. She partners with community agencies, schools, health clinics, and worksites. A theme throughout her scholarship is the role of family and culture in health behaviors. I'm so glad to have you with us. A lot of us were looking forward to your session during the Volunteer Summit back in February. I can't believe it's already almost May, but here we are. I'm glad to be here with you sharing this space, and I'll let you go ahead and start.
Great, thank you. Thank you for the invitation too. I apologize that things didn't work out. It's been an crazy year, and things I think I'm going to be able to do have not worked out. In fact, I was navigating homeschooled children right now earlier, and a pandemic puppy that doesn't know how to be quiet when I actually do have to talk to people. So my eldest took him upstairs, which was good. So hopefully he won't interrupt us. But I'm excited to be here, and since it's a smaller group, maybe it'll help me a little bit if people can do a quick introduction, and if there were specific things you were interested in learning about. I talk a lot on, I could talk a lot about acculturation, acculturative stress, health outcomes. I've also done presentations on working with Latinx individuals in different types of settings. So I know I was on the books for acculturation and acculturative stress, but I don't know if there are other things within that realm that people would be interested in hearing about. So maybe we could do some quick introductions since it's a smaller group.
Suze, you're on the top of my screen if you want to go first.
Hi, yeah, I'm Suze Bono. I work as a bilingual parent educator with Family Lifeline. So I work a lot with parents, new parents. And because my position is a bilingual position, I work a lot with Spanish speaking folks from all over Central America and Mexico. Yeah, I also do work with actually all of the families I work with are pretty recently arrived and are navigating. One of my roles is to support them navigating the medical system and also all the systems. They have varied documentation status, so there's a lot of challenges we face with that and just getting the support for them. So yeah, I'm super glad to be here.
Thanks. Maybe Audrey?
Nice to meet you and very happy to be here as well. You can see Audrey Short, she, her, hers, and I started working in a transitional bilingual Spanish program, K2 level, 1994, and since then I've been in public ed in different levels, going up the grades, community college in the Bronx with mostly Dominican and Puerto Rican students teaching ESL. And currently I've done ESL at VCU for about 12 years, and right now the last 3 years I've been an administrator and faculty member in what we call VCU Globe, which is a living learning program. And we partner sometimes with Sacred Heart and some other locations to help. I think of it really more as our students are learning more by going out into the community, but for community-based learning. And so I'm just always interested in learning as much as I can about what is going on.
Nancy?
I'm Nancy Williams, and I volunteered with this organization a couple years ago, just driving women to classes, to driver's license classes. So then I had a period where I couldn't be a volunteer, and so now I'm thinking I'm able to jump back in, vaccinated and all that kind of stuff. And I have a friend who is from Mexico, single mother, 3 daughters, 1 son, and the family just lives under stress. particularly with this preteen, well, he's an early teen boy. And so I'm just got my antenna up about ways to hear her and understand and know where I can be a good friend and what my limits are in that situation. So this is personal for me. So thank you.
Thank you. Sarah?
Yes, hi. I'm the Capacity Building AmeriCorps member with Reestablish Richmond. I've been a volunteer in the past, and I'm now in this role, and I'm just here to learn whatever I can to help support our clients, as well as, friends and others I know in the community.
Great. Thank you. Oh, two Sarahs, another Sarah.
Good morning, I'm Sarah Chua. I am the volunteer engagement coordinator over here at Sacred Heart Center, and I just wanted to join and say hello and see what I can learn.
You could teach us this. All right, Lindsey?
Yes, good morning, everyone. My name is Lindsey Goodrich-Comline. I'm really excited to be here with you all. I am currently about to finish up my Master's of Social Work at VCU in the clinical track. And this year I've been interning with the Health Brigade, which used to be the Fan-Free Clinic in their mental health department. And using my whatever level of Spanish fluency I have, I to be a mental health clinician who can work with a growing Spanish-speaking clientele at Health Brigade. So doing a lot of mental health intakes and interpretation for different clinicians as well. And after I graduate, I'm hoping to continue improving my Spanish for one thing, but also continuing to work with Latinx communities, both in Virginia and then abroad. I have an opportunity to go to Guatemala for 10 months starting in January. I'm really grateful for that. So I really want to, I guess my background in this too, I've spent a year living on the border in El Paso, Juarez, and time in Nicaragua and Guatemala for work and different things. So I think of myself as a bridge builder and trying to build understanding between communities of people. And so I'm excited to be here and learn from you, Dr. Corona.
Great, thank you. And I see in the chat that Penny says she's having audio difficulties, or they're having audio difficulties, excuse me. Penny works with VDSS, Office of New Americans Refugee Resettlement Program, and they are here to learn. That is, my growing edge is my pronouns, if you can tell. I work with my students on this all the time. And it's even harder in Spanish to use gender inclusive language, which has been very interesting as well. So we have one more, Sherman.
Sherman is actually one of our AmeriCorps members. She can't unmute herself right now, but yeah, she's part of the Economic Empowerment Program, so I'm sure this will be helpful one way or another for her. And I just want to jump in real quick and say I'm really interested in learning about acculturation gaps between children and parents. That's how I actually learned about your research and your work. So I would love to hear about that if you can.
Great, great. Well, again, thank you. Let me tell you guys a little bit about who I am that you don't necessarily see on the bios you see in the websites and such. So I'm actually from California. I'm a transplant from California. I came to Virginia in 2004, which was a bit of a culture shock here to move from the Central Valley of California, where there's a lot of Mexican Americans, Mexicans like me. And then I was in Southern California for school. And then I came here and I was like, oh my gosh, this is very different. And not just in the sense of that there weren't a lot of Latinxes here at the time, but just the diversity in the population here was very different than what I grew up with. But I've been here since 2004 and have had a lot of good opportunities to do some work in the community here. I'm also a first generation scholar, and I work a lot with graduate students who are also Latinx and bilingual, which has been really neat. One of the first things I did when I landed here was I partnered with Tanya, who is now at Sacred Heart, but who at the time was in the City of Richmond's multicultural office. And, you know, if anyone knows Tanya, she has her hands and toes and just about everything and everything Latinx related out here. And she was telling me that there hadn't been a focus or a needs assessment done on Latinx kids, that they had done some on immigrants and some on adults, but no one had focused on kids yet, which worked out very well for me because much of what I do is kid and family focused. So we partnered together and did a needs assessment, and some of the early findings we found in 2005 were that there was just a real lack of bilingual services in this area. And then we kind of identified kind of priority areas, and some of those were risk behaviors and just parents not understanding, right, the kind of the American culture and children going out and how to protect them from engaging in risky behaviors, to just difficulties in schools. And then, as you guys have been mentioning, some of the difficulties in the families that can result from different acculturative processes. So based on the needs assessment, one of the first things we did after that was we established the VCU Latinx Mental Health Clinic, to try to get more mental health service providers who were bilingual and who could work with families in our community. The difficulties with the clinic is that it's reliant on having student therapists in our training clinic. And so I try not to advertise the clinic because we're open and close, open and close, open and close, depending on which students we have in the training clinic at the time. So when I work a lot with a doctoral program here. So when I admit students, I try really hard to admit bilingual students so that we'll have some in our clinic. There's a new faculty member, relatively new, I shouldn't call him new anymore, Oswald is more a junior faculty member, who has joined VCU, who partners with me a lot on our research. And so I made him the co-director of the clinic as well. So now we have 2 bilingual supervisors, and we're both bringing students into the clinic. So hopefully we'll have some student therapists in there soon so that we have some more options for mental health services for folks in our community. But I give that example just to show that much of what I'm doing is focused on my research, but then it informs my clinical supervision and teaching and mentoring, and then that then informs what I'm doing research wise. So it's this real kind of like circle where I learn from one thing, it impacts the next thing, and then I just keep going that way. So I'm not the type of researcher who's just sitting in my office and saying this is what I'm going to do and that's all I'm going to do. For me, it has to have some sort of impact for the community. So I've been partnering, as I said, with Tanya since 2004. I partnered also with folks at Crossover Clinic, and then I have done stuff with Health Brigade when it was still Fan-Free Clinic. So it's been fun, but I'm sure many of you guys know that when individuals immigrate to a new culture, there's going to be a process or a time of adjustment to the new norms or to the new environment. And sometimes that works, and sometimes they're in conflict with some of the values you may have or some of the experiences you have from your host country. So for Latinx individuals, for example, I always tell this story, in my culture, there's no real Spanish word for sleepover. Because, why on earth would you ever sleep over at somebody's house if they're not family? Like, that concept doesn't make any sense. But then, when kids come here or are growing up here, I mean, you're doing sleepovers left and right with people who are just in the neighborhood and stuff. And so oftentimes it's those types of things that can cause these little gaps in family relationships, because the kids are wanting to be just like all the rest of their peers, but then the family is not quite sure how to navigate this. And it can get even trickier in mixed status families, where there's a lot of that kind of need to protect the family, especially in the current climate, so that things aren't happening to the parents. So some of the with acculturation, some of the difficulties that immigrants often experience are language difficulties, which I'm sure many of you know about, right? Children are going to acculturate to a new culture faster than their parents. So they're going to pick up the language faster, whether it's because they're in school or they're in more social settings, or just because their brain is younger and hasn't set a lot of their neuronal paths. But kids are going to acculturate a lot faster. And what that does with language is it can create a conflict in the family and a role reversal in the family, where suddenly kids have kind of more power than their parents because they're often used as language brokers in different settings. And so we did some research on that early when I got here as well, just to understand, in what types of settings were the children having to translate and interpret for their parents, and what was that experience like for the kids, and what was that experience like for the parents. And, unsurprisingly, the children were translating in a lot of, or interpreting in a lot of different areas, including medical appointments, in schools, with rental agreements, housing. I mean, they were just doing a lot of stuff. And for both the parents and the kids, it was a bit of a source of stress. And for the parents, a little bit of stress because, again, it's not easy to be that reliant on your young child, and you don't often want to be having your child have to grow up so quickly. And then for the young adolescents, it was stressful because, you can imagine walking into a medical setting and your sister's medication depends on you being able to interpret that correctly. And so they'd get very panicked about, like, if I get this wrong, then what happens to my sibling? They could possibly die because I'm not doing this right. But there was also this really neat sense of pride that stemmed from language brokering, both for the parents and the kids, in the sense of one of our cultural values is really focused on family, so familismo, and really helping the family in a lot of different ways. And so kids actually felt pride that they were able to help their family in different settings. And then the parents felt pride that their kids were able to do this, and that they were more bilingual than the parents were feeling that they were. So while it creates conflict, there was also some really neat opportunity for family pride. So that's one area where you see some difficulties within the acculturative process. And as Helen, as you were talking about, the acculturative gap is really just that the parents are acculturating at a different pace, typically much slower than the kids are. And it can create problems in language. It can create conflict for the parents and kids. Again, because like the kids are adjusting to the American norms of going out and sleeping over and being in different environments, and the parents are still not used to that. And it creates difficulties because if they were in their home country, they'd probably have a lot more community and a lot more family around them. So it's not that the kids in the home country aren't going out and doing these things or potentially being in risky situations. It's just that your level of family and support is very different there than here. And so you see that conflict of, I don't have anybody who can watch my children, so I don't want them to be out and doing things. And then the kids are like, but this is not fair. This is horrible. All my other friends are doing this. And so you see these real difficulties within the family relationship. You can also see some acculturative gap or acculturation difficulties when, which I'm sure you know about, sometimes you'll have parents come over and then their children are coming over at different points. And so you have some acculturative challenges or family relationship dynamic challenges, because depending on the age of the child when they're coming over, if they're an adolescent and have been raised by their grandma somewhere else, and now their mom is here and wanting to be more of a parental figure, you could see some conflict there where the adolescent's kind of like, no, you're not my mom, like this is not right. So there's different opportunities for different types of conflicts. The one thing I will say just in general, since many of you guys are also working with adults and not just children, is the acculturation process has, at least in the literature based on the research, has some really mixed findings. So I'm not sure if you've heard of, typically what we find is that for some health outcomes, acculturation is not good. So for example, Latinx who are more acculturated are more likely to engage, to have mental health issues, or they're more likely to have substance use issues than their peers who are less acculturated. But it's not true for all outcomes. And so, for example, in the sexual health field, Latinx who are more acculturated are actually more likely to use condoms and or more likely to talk with their partner about using condoms. So it's this funky construct that has really mixed findings depending on the health outcome that you're looking at. And so in the literature, we talk a lot about the immigrant paradox, which is kind of why are immigrants faring better with certain health outcomes than individuals who have been here for a longer time. Because the idea is, right, that that immigrating and acculturating to a new country creates stress. And that's where you get the term acculturative stress, right? That having to learn all these new things, a new language, having to find a new social support network, having to raise children in an area that's unfamiliar to you, all of that causes stress, which should then make your health worse. But all of the literature is showing that immigrants are actually doing better than our their US born counterparts. And so it's this really interesting, I can't even say, this has been a paradox for many, many years. And I don't know that anybody has actually figured out like why, like what is going on, other than there may be some resilience that comes from an immigrant's journey. There could be really big differences in the host country and their experiences there versus their experiences here, you know, especially if someone's fleeing a war, they may have a different hardiness when they get here. So even though things are not easy here relative to where they were, they feel a little easier. So the psychology makeup of that is what's protecting them from poorer health outcomes. And you see this across different health outcomes. It can be a medical issue, physical health, you see it with mental health, you see it with substance use. So it's a really interesting finding. But there are also some kind of, there's a lot of issues with the acculturation literature. So I tell the students that I work with, like, acculturation measures are not that great, and there's a lot of issues with how we address this. But there's some interactions with gender as well, so that some of these outcomes are more pronounced for men than they are for women. So there's a lot to go with the acculturation literature. And I mean, in general, it typically is associated with as you acculturate, your health outcomes get worse. And every time I say that, people will always ask me, well, what is it about US culture that makes people not, you know, healthy all of a sudden? And I'm like, I don't think it's necessarily US culture. I think it's just that there are different kind of psychology makeups that immigrants hold that US born individuals may not, or their counterparts may not have, because of just their lived experiences. So let me think, what else about acculturation, or if there's anything specific. There are some neat therapies for helping reunification, because obviously when a kid and a parent are reunifying after after some time apart, for whatever that reason was, there are some therapies out there that have been shown to help. A lot of times when I'm working with families, or when I used to work with families, I actually don't do any clinical work anymore other than supervision. One of the biggest strategies was really to externalize the conflict that the families were having, that it's not about the parent and the kid, but more about the culture they're now in, and as a family learning to adjust to the new culture. And so that it doesn't become like it's my mom who has to change, or the mom saying, or the dad saying it's my child who has to change, but rather the family has to learn as a unit to adjust. And taking that type of approach where you're externalizing it to the culture and not about the family, it is very in line with our family values, which are really to be focused on the family unit and to have respect in the different relationships within the family unit. So that's another area where sometimes you'll see conflict between parents and kids. another of our cultural values is respeto. And so we have, we are socialized to really show a lot of respect to our parents and to our elders. And sometimes you'll see that conflict coming the more time kids spend with some of their peers or their friends out here. I've actually been really curious if you see this as much in states like Virginia or in other states that are more Southern, because you see a similar focus on the family in Southern states that's very different than you do in Western states, like California. So I've actually been very curious if there's a difference, there. But you'll often see that type of conflict happening because the family is a unit and operates as a unit, and you don't want to kind of be in a mental health setting and having a kid and a parent both thinking that it's the other one's problem and the other one has to adjust. So you use a lot of different strategies to try to externalize what they're going through and basically placing the blame on something else. But there are some strategies for working with families who are having to reunify. There are strategies for working with Latinx individuals who are just struggling in general with acculturation stress. And then, some for working with them if they're experiencing depression, anxiety. We see a lot of, in the clinic that I direct, we see a lot of anxiety, depression, and trauma. Trauma is another really big thing we see that can really impact someone's acculturative process, because trauma it really can impact everything you're doing in your daily life. So I'm trying to think, like that's acculturative stuff in a nutshell. I mean, there's specific research out there for different things. There's one thing I often like to emphasize, and I'm sure you guys all know this because many of you guys are working with Latinx folks. There's just a lot of variability in our ethnic group. And I'm Mexican American. My parents are both from Mexico. They immigrated when they were children, and my dad when he was an adolescent or a young adult. I was born in the Central Valley, and my experience is very different than someone who's Dominican or someone who's Puerto Rican or someone who's Cuban. And there's just real differences in the immigration laws that all of these groups faced in coming and still in coming to the United States. And those immigration laws, while many of them happened a while back, they still have a real impact on the population you see now in the United States. And so I really like to emphasize there's actually more variability within our ethnic group than there is between Latinxes and whites, Latinxes and Black. There's actually more variability within our group. So it's really important that, there's just not a one size fits all for working with us or how we're going to acculturate to the United States or navigate the immigrant journey, because people are they're coming for very different reasons when they're coming, and then their paths here are very, very different. So that's one thing I often like to emphasize, just that there's a lot of heterogeneity within our population. And you'll see that in terms of our country of origin, our political and social history. You'll see some variability in educational levels, acculturation levels. I mean, there's just so many levels that we're going to be very different on. And so it's important to keep that in mind when you're working with Latinx individuals. I don't know if any of you guys, I transitioned to using Latinx just because it's a more gender inclusive term. There's actually a lot of debate among professionals because it's not a term that outside of academia has really caught on yet. There are some pockets where it's catching on. So there's been these really interesting debates about what we should even be using. And so I often tell people, like, the label or the term you use should be whatever the person you're working with is using. There's no need. When I write, I have to create a label because I can't write a paper that said I had 194 participants and then name all their preference terms. And so I have to create some sort of pan-ethnic label. But I've transitioned to Latinx. I avoid Hispanic whenever I can, just because Hispanic is just basically people who speak Spanish. So it will not include Brazilians who speak Portuguese won't fall under that category. And I also avoid it just because it would include someone from Spain who immigrated to the United States, who has a very different immigration experience than someone from Latin America who has come. So I really focus on the term, for me, Latinx is the one I use because I'm trying to be much more gender inclusive and with that. But we talk a lot, but I often tell the students, you know, when we're working with people, just ask them what they prefer, you know, what term they would prefer for themselves, because that's really what we should be focused on, their identity, and not what we think they should be called. Sorry, I'm looking at my notes. Yeah, so as I said, it's the other thing I talk a lot with, and that's picking up a lot more now, are just the intersections of identities. So, you know, we work a lot with Latinx individuals and bilingual individuals, but they intersect, their identities intersect on a lot of levels, whether they're also female, male, or transgender, whether they're immigrant or not, their education levels, just a lot of different identities, and trying to navigate that is really important. And so you'll see that in some health settings, we find that certain cultural factors are actually protective of the immigration or the acculturative experience. So some Latinx cultural factors like religiosity actually buffers the negative effect of health outcomes. So someone who is high in religiosity is going to be less likely to have a negative health outcome than someone who is lower in religiosity. Other cultural values that seem to buffer those negative health outcomes are familismo, so that focus on the family seems to be a buffer. I think in some of our work, we've actually found that respeto also has some buffering effects. And so there are some cultural values that are actually really important to kind of strengthen. And so what we've learned over time in the acculturation literature, when it first started, people used to think like immigrants are coming and they're acculturating, which means they're just adjusting to this new culture. And as they're doing that, they're losing their values from their old culture. Well, over time, we realized actually that's not true. I could be very acculturated to the United States, but I could still hold a lot of my own cultural values. So I'm a good example of this. I'm much more acculturated than my parents in terms of language, education, things like that. But I hold very high in my life my cultural values of familismo, of respeto, of spirituality, religiosity. So I still hold those. I didn't lose them suddenly because I acculturated to the United States. And so now people are seeing acculturation less as a linear process and more as a bidirectional process that both can affect, and I can be high in both, I can be high or low in one. So in addition to acculturation gaps that you see within families, parent and kid, you can see these different acculturation typologies within an individual, meaning you can have someone who is very highly acculturated but has very low of their what we would call enculturation, ethnic identity or cultural values are low. So they are high in one, low in the other. You can have people who, as I was describing myself, who I would consider myself high in acculturation, but also high in my ethnic identity. I think and then you could find people who are higher in their ethnic identity, but lower in their acculturation. I think the one area you don't find nearly as much are the low and low, that little low and low corner. But each of those typologies is also differentially associated with health outcomes. And so what we know in the literature, and I'm sure you can guess, it's the people who are more bicultural, who are both, right? High in acculturation, but also retaining cultural aspects, who have better health outcomes. And so that's the other kind of acculturative piece that you'll find in the literature. And there's a lot of new measures now that are tapping into these different acculturative pieces, and much less literature coming out now with that linear idea of acculturation, that I have to lose part of myself in order to become acculturated to the United States. That's a very outdated way of seeing acculturation. So I think those are the main takeaway points. I don't know if there are any specific questions you all had that I can maybe try to answer. I tend to have a lot of stuff in my head, which sometimes it just takes a question to get me to remember to get it out there.
Lindsey, you look like you might have a question.
I have a very expressive face, so I get that a lot, actually. I'm thinking about Dr. Corona. So I've read some of the things, some of the studies you're referencing. It's really, I just want to say, I've referenced them in my papers and read through them. So it's really wonderful to be here with you. I knew that before, but I didn't want to say that. And then just hearing you talk all about it is really wonderful. So your name is in my papers in all the reference sections, not all of them, but in many of them. So one thing that I've read a little bit about, and I don't know how it relates, and I don't know if it's, but I hear it come up sometimes, and I want to understand it. So you've got acculturation and theories around acculturation, but then segmented assimilation. Do you know that theory? And it doesn't sound like a good one to me, but if not, it seems similar in some ways because it talks about, and maybe this is too academic, but what I've read is like it talks about people maintaining connection to their cultural identity, to their ethnic identity as a protective factor for, basically adjusting to their new location and for just a variety of different like health outcomes, and also trying to remember. Anyway, that came up in my head as you were speaking, but if it's not relevant to the work that you're doing and it's somebody else with other ideas, that's fine. I don't know.
No, and Lindsey, just so I remember, I have 2 or 3 social work students in my class this semester, which has been just wonderful because they give the clinical psychology students a different perspective on everything we talk about. So it's been really fun. My understanding is that segmented assimilation is just another term people use. This is the other problem with the acculturation literature. There's a few problems with it. One of them is everybody uses different terms to describe similar constructs or processes. And so as a result, the literature is very muddy. Like it's hard to figure out like, why is this study finding this and this one's not? And a lot of times it's just the way they're defining the terms that they're using or the measures that they're using. That's the other big issue with the acculturation literature is the early measures were very like, how often do you speak English? Do you watch TV in English? Do you listen to the radio in English? What type of food do you eat? And that's how they measured someone's acculturation. Like if I answered that I ate a lot of tacos, suddenly I'm not as acculturated as someone else who's not eating a lot of tacos. So the acculturation measures were really bad. And then people use a lot of proxy measures, which are typically associated with acculturation. So by proxy measures, I mean someone will say, I'm going to look at immigrants versus US born, and I'm using that as a measure of acculturation, that I'm expecting that the immigrants are going to be less acculturated than the US born. Some folks will use language as a proxy measure of acculturation. People who speak primarily Spanish are going to be less acculturated than people who speak primarily English. But there's issues with that because someone's preferred choice of language doesn't really tell you how acculturated they are or they are not. It could, but in a mental health setting, for example, I can be working with someone who code switches, right? Which is why it's important to have bilingual providers. And even for a child, even if a child comes in and says, they speak English all the time, I'll ask, but what do they speak at home? And they'll say, well, they speak Spanish because that's what their parents speak. And so I'll tell the students, sorry, if all you can speak is English, I can't have you in there as a mental health provider for the kid, because their emotional learning was probably in Spanish and not in English. And so they'll code switch. And if you have someone who doesn't understand what they're saying, then you're gonna have some difficulties. Or if you're allowing them to only talk in English, they could be defending against some deep emotions that they're having because we're not asking them to talk in their preferred language. So there's a lot of issues with the acculturation field and measures. They are getting better, but those are all the like little tricky things. But I think segmented assimilation is very similar to what we talk about when we talk about acculturation and enculturation, that as you're going through this process, you've got the acculturation to the new host country, and then your enculturation to your original, your host country. So I think that's when they're talking about segmented. Segmented makes it sound really bad to me. I don't know why. It just sounds like you're not a whole, kind of, which sounds just weird to me, which is why I like the kind of focusing it less as the person, but more on the process of acculturation.
That's helpful, because I didn't really like the term, but it's come up and I was trying to understand it.
Yeah,
so-
and you know, every discipline uses different terms too. That's the other thing I've learned in psychology. We're really focused on making sure we're not talking about just one linear acculturation anymore. Like if I try to submit a paper and that's all I have, I'll get dinged really fast on that. And then I'm having to justify why I didn't have other measures. But in the med field, it's like still okay to say I'm using a proxy measure of acculturation. And I'm guessing that that's very different in like sociology, how they're defining these processes are going to be very different. And so the measures coming out of all the disciplines can be very different, I find.
I have a question, if that's okay. You just spoke to it somewhat anecdotally, and I think that you know, it feels intuitive, but I'm wondering if there has been research to back up, and if you could speak to that or share any resources about health outcomes being directly, so physical health, mental health outcomes being related to language, a provider sharing language and sharing cultural identity with patients.
Yeah, so that's a really, it's the race ethnic matching literature that we see coming out of mental health. So early, gosh, I feel like 80s and 90s, a lot of that literature came out, especially around immigrants. So if they go into a mental health setting, do they have better outcomes if they are matched either with race, ethnicity, or by language with the provider? Now, obviously, you kind of need them matched by language if they only speak one language. So, but interestingly enough, the race ethnic match doesn't provide better outcomes per se. And there have been a lot of meta-analytic studies that have demonstrated that. Now, what I always tell the students, because I have a lot of students who are like, what? That just doesn't sound right. Like, that's horrible. Of course, if their feeling really is like, if I'm a Black student, of course, I'd better connect with someone. And I tell them, well, I think part of the difficulty in what we're seeing is how people define outcome. So while it may not affect outcome in terms of someone's mental health reporting, what it does affect is alliance building. So when someone is matched language and race ethnic, it actually does help with the relationship. And the relationship is kind of seen as a mediating factor between therapy, relationship, and outcome. They're all supposed to be related. So you do see this increase, meaning that people will stay in therapy longer. They feel more connected to their therapists. They understand things better. But what we're still not getting is that it's improving outcomes per se. And so some of the hypotheses with that is that, you know, in the Latinx culture, and when I say things like that, it's very, again, I'm generalizing because it's not all Latinx that are like this, but, you know, in different countries, there are different help-seeking pathways. In the US, we try to go to our doctors for our help. But in some Latin American countries, if you're having a problem, you actually go to your pharmacist, and they're the ones who are telling you what medication you should be taking. If you're in some Latin American countries, you actually go to your priest around a family related issue, right? So our help seeking pathways are very different. And so what I think is that missing gap, sometimes I lose my train of thoughts and I'm like, why did I suddenly start talking about help seeking pathways? What I think is the missing gap is that when we're doing these studies on treatment, alliance, and outcomes, some Latinx actually don't seek out mental health care until they're pretty severely impacted by it. And so I think that's why the outcomes don't look like they're improving, because they're already so severely impacted by what's going on that they finally decided to go outside of the family for help, because that's not, for many Latinx and many immigrants, that's not a thing we will do. Everything stays within the family. Like, we are socialized, like, don't air your dirty laundry to anybody, like, don't tell your teachers, don't tell anybody. And so I think that's why that happens. So to answer your question, Susan, it's kind of a yes and a no. Like, it matters for alliance building, which we know is really important, because alliance building keeps people in treatment longer, but we're not seeing the same effect for the mental health outcomes yet. But I think people will, once they start controlling for the other factors that are there. Language is a really tricky, is tricky, because as I was telling you guys earlier, there aren't a lot of bilingual providers here, but and as a result, a lot of kids will we call it language brokering. They're translating or they're interpreting for their parents. And in the study I did, as I said, the kids found it stressful, and they found it, they took pride from it, but they also could get really tricky with it. Like, we had a young boy in our focus groups who was like, yeah, oh, I have to do that all the time with school. But when I tell them why the principal's calling, I just tell them because the teacher thinks I'm so awesome at school. And, my parents don't know any different, so I just don't get in trouble. And I was like, oh my gosh. So it definitely, it happens. But the one thing I often like to share is that it's actually illegal to pull someone into a language brokering situation if your organization receives federal funds. So if they are in a hospital setting or a school setting, those settings have to provide certified interpreters. They cannot just go and say, hey, this nurse speaks Spanish or this teacher speaks Spanish. They have to have a certified interpreter. And in fact, some of the schools out here were under investigation by the Department of Education because of this issue. So I like to remind everybody that, and it's actually something I have to talk with my students a lot about, because many of the students I work with are like me. We walk into these different settings, and I'm sure you do, and you're bilingual and you're like, I can help. And I'm trying to tell them, like, you have dual roles here. Like, you're walking into this school as a researcher. You shouldn't be jumping into these other settings and these other roles without permission in some way, shape, or form. Although it's just very hard not to do it. Because I remember I was sitting in a school one time, and this poor family was coming in. They thought they had to come in, and there was no one who was really, like, they even brought someone to kind of help them with the English, and it still wasn't working. And finally I was like, okay, this is ridiculous. And I broke the rule that I tell the students never to do, but I was like, this seemed pretty low key. I could just tell them, you can go home, everything's okay. But there's been a lot of people learning that here. And I think, again, it's just that there's not as many bilingual providers here. And so, people want help, and they try to get it however they can.
I have a question. I'm wondering, is there any research or researchers that you can point us to that are doing this kind of similar work, but focused on the Arabic speaking community? As you were talking, I'm from that community, and I was like, there are a lot of similarities, I think, but there will also be some things that are unique to our experience, our status, so I'm just very curious about that.
Off the top of my head, I don't. Yeah, even based on what I know from what I teach in class, I don't know. Definitely nobody here I know. But I can look into that for you, Helen, because I agree with you that one of the big things that's important is that there's just going to be a lot of differences depending on the immigrant population we're talking about. I primarily work with Latinx families, and every now and then I'll have Black families that have immigrated, but that's primarily. Sometimes I'll work with Asian families too, just because they have some very similar cultural values to Latinx families. But I don't know off the top of my head anybody who does that work here. I'm even trying to think in social work if I know anybody, and I can't think of anybody.
That's still good to know as I'm thinking of grad school. There's a gap there.
Yeah. And you know, the as you're thinking about grad school, there's gonna be gaps in a lot of areas just because the geographic kind of just the mobility of folks in the US is really shifting. And so, you know, one of the things why we're seeing an increase in Latinx here, for example, is that they're not actually just immigrants from Latin American countries. They're actually people who were coming from Arizona, Texas, California, and then coming here, or from New York and coming here. So they're not necessarily immigrating from their host country, but they're immigrating they immigrated from their host country to another state, and then from another state to Virginia. And we're seeing that with other populations as well, that there's a lot of mobility happening that's going to really shift the geographic demographics of the United States. And it actually already is with the Latinx population. We talk about the Latinx population in states like Virginia and what are some of the Georgia as emerging Latinx populations, because the groups have doubled in like the last 10 years. So from being pretty non-existent to suddenly being a bigger population here. But then those experiences of individuals in these emerging communities is very different than someone who's going to immigrate to California, Texas, or Arizona. So again, in addition to differences in your host country, there are going to be real big differences in the reception area that you're in that can impact health and that can impact acculturation. So when you keep it in mind, think about that too, because there's going to be different opportunities based on the kind of host environment as well.
Yeah. Thank you. One thing that I was thinking about, this isn't a question, more just like thinking out loud with you all. One thing that when you were saying you feel like you're bicultural, I was thinking, I feel like I am too, despite coming here really early, like in 2019. But I think part of that is because of US like influence across US borders. So I don't know if that's like a fully positive thing as well. So that was just a thought I wanted to share.
Yeah, the age of immigration really matters. So in you might have heard people will often use terms like first generation, second generation, third generation, and there's debate and differences based on the field. But first generation should be the immigrants. Second generation would be people like me who have two parents who are immigrants, but were born in the United States, and then so on. Third generation is someone who was born and their parents were born in the United States. And then there's this category that we call 1.5 generation, which is exactly that, because someone like my mom who immigrated when she was 8 is very different than my dad who immigrated when he was 19. And so their experiences and their paths, their interactions with systems are going to be very different. Again, because children acculturate to the norms and the new culture a lot faster than adults do. So my dad always had more difficulty with language than my mom did. And so we call those the 1.5. My dad would be my dad would be an immigrant. My mom, or first generation, my mom would be a 1.5 because she came younger, so she's a little more like a US born person, or has that, she's kind of in between the two. So you'll see those terms in the literature as well, and those generational statuses are linked to different health outcomes as well.
Anyone have any other questions?
I'm sorry that I'm going to have to leave, and I just wanted to say thank you very much. My 2 seconds, and I really need to get to this other meeting, but I'm curious, I am assuming, Rosalie, that you're familiar with Francisco Jimenez?
I think so, but...
Okay. I know, here I am using an old school book, because I'm actually reading to my child.
Oh, nice.
So, Cajas de Cartón, Senderos Fronterizos Más Allá. Have you? Yeah. It's a book that I highly recommend. They're in English and they're in Spanish, and it goes through his journey of coming I'm also California based, LA, went to school at UC San Diego,
Yeah.
you know, when you could just go to Mexico at a time before all the borders, whatever, just a different generation. But there's so much richness in these books, and they're middle school readers, and they're available bilingually. And I was kind of, I love them, but I'm also not Mexican American, and there's also a little part of like how, you know, every experience is different, and I think you brought up a great point with that. But I also know that sometimes I'm half Japanese, and when I read some things, I'm like, ooh, you know, are you selling that book? Or like,
Yeah. Well, yeah, I don't know. I don't think I'm familiar with that. But I do, as the students I work with know, I read a lot. Like, it's my favorite hobby is to read. And I actually just finished a book called Infinite Country by Patricia Engel. It's a fiction book. I read fiction. And this one's about an immigrant's experience coming from Colombia. And one of my friends posted like, oh, this book was hard to read, the migrant's experience. And I was reading the book. I'm like, actually, it's really not that difficult. And then I hit chapter 19 and I was like, oh, because they actually took the perspective of the kids, and it was the kids who were mixed status. And it was a very different way of experiencing it. And when they hit that really hit me. That was hard to read because it was in the era of Trump and all the discrimination against the Latinx community. And so the kids' perspective versus the parents was very different. And so I'll put that on my list. I say that because I love to read. My shelves are filled with books around a lot of different cultural experiences, because as I tell the students, you know, we don't always grow up having money to travel and immerse ourselves in different cultures, but another way you can do that is through books.
yeah. Well, I wonder. I gotta go to that meeting, but the reading book that was for VCU, the letters. What was it? The 20 letters. 40.
Oh yeah, the one.
Luisa. I know.
Yeah, I know which one you're talking about. The essay one.
Yeah.
That was really good too. I always have that one. At the end of the lectures I do in my class, when I do them about different populations, I have a list of all the books students can read.
I might invite you to follow up to ask about this. I'm so sorry. I need to go, but thank you. Lovely to see everyone. Nice to meet you, Rosalie, and we'll be in touch. Thanks.
All right, thanks.
Bye.
What was the name of the author of the book Audrey mentioned? Jimenez was the last.
Francisco Jimenez, I think she said.
Yes, that's right. Okay, thank you.
So it doesn't look like we have any more questions, but thank you so much, Professor, for being here. I think we all got something out of this conversation, whether service providers or academics, and it was really helpful.
Great, thank you. It was really nice to meet you all too.
Thank you so much.
Take care.
Thank you all for being here.
Thank you, Helen.